over and mute you. There you go.
Again, thank you for everyone for joining us in person and online. Appreciate y'all being with us today. July has come and it's going quickly. I have never seen a summer go by so fast that I can remember. I think it happens that the older you get, the quicker they go. It's nothing like being a kid waiting on Christmas, right? So we're going to go around the room and have introductions because there are some new folks with us today. My name is Tabitha Curtis. I'm the chairperson for the Franklin County Prevention Coalition, and I work for the Tennessee Bureau of Investigation as the Tennessee Alliance for Drug Endangered Children statewide coordinator. Melanie?
I'm Melanie Morrow, and I work for the Franklin County Prevention Coalition.
Can I make a request, Tabitha? People really talk up because this air conditioner, I'm sorry, I'm having trouble hearing.
Okay.
Cut one off.
With my age too. So,
Please, okay.
We're gonna turn it off if it gets too hot in here, let me know, because this room will heat up quickly. But it is hard to hear over that, so. And everyone remember, we got online people, so really try to.
Well, they're saying there's no sound.
No sound?
Yes.
Uh-oh. Okay.
Can you hear us now? Okay.
Yay.
Yes.
I'm Jaden Van Zant, and I am a youth ambassador for the Franklin County Prevention Coalition.
I'm Mason Tabor. I'm an intern at Camp Rain and the Journey Church in Winchester.
I'm Dustin Ritchie, regional overdose prevention specialist.
I'm with Wallace, I'm in pharmacy.
I'm Scott Holloway. I'm with the reentry program, Franklin County Jail.
I'm Lynn Ventola. I'm with the reentry program.
I'm Emily Martin. I'm a partner for healing. I'm Jessica Radley, and I'm a partner for healing.
I'm Elizabeth Rector, I'm from Tennessee. Rachel Swafford, I'm from Tennessee Department of Health.
Kelly Riley, Franklin County Industrial Development.
Sharon Bauer, from Franklin County Mayor's Office.
I have Brandon Steen with Wings of Hope Wheels Ministry at Winchester First United Methodist Church. And I used to be with the reentry program, so I need to be.
Mac Moore, well, District.
Heather Lee, Health Connect America. Megan Athlon with DHS Hope Rehab Department. Nancy Kilgore, Health Connect America.
LaRonda Martin, and I'm with the Franklin County Prevention Coalition as the Drug Endangered Children Coordinator.
Paula Rhodes. I'm with the Franklin County Prevention Coalition.
Angie Fuller, I'm County Commissioner and also with the Kiwanis Club.
I'm Roan Riley, I am the AmeriCorps Vista for Franklin County.
Cindy Smith, I'm with the Kinsborough and actually today, Franklin County Prevention Coalition.
I'm Laurel Stone. I'm a child care resource and referral and also represent Franklin County Community Advisory Board and Isaiah 117 House.
My name is Sophia Leon Meza. I am the health educator from Franklin County and council facilitator. I wear many hats, so.
Right, we do a lot. It's hard to remember what our title is. But I'm Jessie Sheehan, the Franklin County Prevention Coalition Director.
Okay.
And online,
And online we have,
we have Meredith is online from, she's with our ropes.
I see Ann Gardner online, and Ann is from Huntland, I know. Kelly?
Good afternoon.
Greg Keeley?
Hi, Greg Keeling in Manchester, and I'm a housing facilitator with the Creating Homes Initiative.
Justin Owens?
Hello, everybody. Good to see everyone. My name is Justin. I am with SOCAT. I'm a community engagement specialist.
Okay, Sabrina?
Good afternoon. My name is Sabrina Moore. I am the Middle Tennessee Outreach Specialist for the statewide Family Support Network with Tennessee Voices.
What happened? Did we freeze?
We didn't, they did.
And Tina.
Hey, Kathy and Tina here. We're with the Franklin County Library. I'm the director and she's our IT specialist.
Hello.
Are we missing anyone?
Beth Delaney, I'm Health Promotion Director with Southeast Region.
Haley Colvin, Health Department Director from Franklin County and Grundy County and Marion County Health Departments.
And I'm Meredith Hugh. I'm the Regional Overdose Prevention Specialist through the Franklin County Prevention Coalition.
Did we get everyone now?
Excuse me, Katie Kelly's here, Clinical Supervisor for Center Stall Mobile Crisis that covers that region.
Emily, I think we missed you.
Hi, I'm Emily. I'm a youth ambassador with the Franklin County Prevention Coalition.
All right, I think that's everyone. Okay, in your program updates, you have the approval of the minutes. I'm sorry, in your package, you have the minutes. So if you take time to look over the minutes, and then if I can get someone to make a motion to accept those minutes, or if there's any changes needed to be made.
Make a motion to approve the minutes.
Okay, can we get a second? Okay, we have a second.
Can I, before we take a vote,
Sure.
I wasn't here last time, so I apologize for that. But I know there were 3 areas of Sophia that we identified. I looked for them in the notes and I can't find them.
We're still final, working on that plan, but I can tell you, I guess, you want to, it's kind of part of my update today. So we're still working on the plan, and hopefully we'll finalize it by next month and present it to you guys. But the 3 areas that were chosen was substance. To go ahead and include tobacco, alcohol, and drugs. And then we chose obesity, and we're gonna go ahead and include physical activity in that, so that was kind of a combined one. And then I think the third one was mental health, correct me if I'm wrong, and mental health. So that's where things are going right now. I'm gonna sit with Jesse and work on a plan and finalize that, and then present it to you guys hopefully by our next.
Will be the next meeting.
Yes, ma'am.
Okay, thank you.
Okay, thank you for that update on that. So we had Miss Angie Fuller, gave the approval of the minutes, and then we had Paula with a second. So all those in favor, say aye. Any opposed or, okay, changes? All right, so the program updates, Franklin County Prevention Coalition. Jesse, you want to start with those?
We've got our newsletter. Lots of updates in here, a lot of good information. Your flyers that we normally print out, we're printing in here for some upcoming things. Thrive. I've already talked about it, I don't know, 5 more times today. Thrive is our youth leadership conference. It is happening next week. We still have openings available. We were given, I think we got a total of 17 scholarships, and I still have a couple left. So if you know a youth in Franklin County that might be able to go, but you know, $100 registration fee is a little out for them. Get with me. We still have some of those available. I thought with my update. Well, I'm missing anything. Just go through the newsletter. Okay.
Tell them to check out our table.
Oh, yes, thank you. We have some of the things that we've been working on, because we've got our 2 youth ambassadors working for the summer, and they will tell you they have not stopped. Rob has been completely and totally on their plate. Jada's done the majority of the planning and the connecting for speakers and stuff for that. But we've also had them putting together the alcohol calendars, which are, and then they distribute those out to businesses that sell alcohol. That's an ID calendar to help the clerks know who they can and cannot sell to. And we've got labels for water bottles. We've got anti-vaping campaigns going on. The flavor belongs in this, not this type of thing. So like it belongs in bubble gum, not in your lungs. stuff like that. So come take a look at it, put your hands on it. These are the things that they have been working on. We are so proud of them. And then just other ways that we're able to get out into the community.
And I may have failed in looking at the website enough, but I know I was looking at websites today. Is all of this available on the coalition website, your update?
And we have more of these, or we can print more of these if you want to have them, because they're open for the community. This is how we spread the word of what it is that we're working on, ways that people can get involved. We are very creative. We think outside the box. So anyone that wants to get involved, you know, in a certain initiative or in some other capacity, this is a great example. We get really creative with what we can do over at Bennett's to get our information out. So if you want to put these out, you know, where you're working, just let us know. We'll be happy to print them and run them out to you.
I just know it's a lot of great information in here, and everybody needs to see all of this going on. Okay, Health Council, Sophia.
All right, so kind of tagging along to what I said earlier about our plan, we were hopefully finish it next month. We had 30 more surveys that were done, thanks to Southern Tennessee Regional Health System. They pushed it out to their staff once again. It didn't really make a whole lot of changes to the results that we had last time, so I will re-download those and send those out again so you guys can see that. And we'll present the final plan next month. So if you want to add something to it, feel free to bring ideas. All right, give a kid a chance. We're doing really good. Backpacks are taken care of. So we have all backpacks that we need. We will actually have some money left over. So between today and tomorrow morning, I'm going to run to Walmart and get some of the items that we need, which are glue sticks, colored pencils, and lead pencils for the older kiddos. So we'll be I'll be buying those supplies with the amount of money that we have left. If you want to come and register, I still have registration forms. Feel free to come see me after the meeting and you guys can fill one out. If you don't have school supplies, but you want to come and give out your brochure, feel free to do that as well. We would love to have you. I also have, there's a flyer in your packet, but I'll have extras. If y'all need some more for your businesses, let me know. Other than that, we're doing really good. I'm very excited about it. Paper hasn't come in yet, but if it comes in late, we will just divide it up between the schools and give it to the schools. So, but other than that, we're doing really good. I want to thank you guys for all your help because we could have not done this without you. The event on Wednesday, we prepped for 650 kids, and we're going to be there. We have it set up to 11:30, but if we still have items left over, we're going to help another group that is having an event at Clark. So I just want to thank you guys for all your help. And if you want to come out on Wednesday, we're going to start at 8:30. It's drive-through, and it's going to be outdoors. So bring sunscreen, tents, whatever you think you'll need that day. If you have questions about it, let me know. I will be here after the meeting. Thank you.
I just want to say, Franklin County, every year, from the time it was started as the Back to School Bash until this Give Kid a Chance, you know, what an outstanding opportunity to support the children and families in our community. You know, take one less thing, take one thing off their plate that they don't have to worry about in getting their kids back to school. So thank you to the community that supports this, as Sophia said, but not only that, for all the hard work that the coalition and the Health Council does to support it. It's that time. It's that time to do the wonderful training, Jesse.
All right. Has anyone not had Title VI training before?
Oh,
Have
boy.
you ever had that before? Okay. If you want the complete slide deck, I have it here. You can take it and look at it because I am going to go through quickly. Okay, unless you guys really want me to go through 71 slides slowly. Okay, But in order to meet our bylaws, we will take a quiz afterwards. We will do the quiz together and we'll pass, so it'll be fine. Civil rights training is something that's, we've all done it. We've done it. It's something a lot of, if you have any kind of federal or state funding, you're required to take this annually. So I know it gets like the same thing over and over again. But when we do our training, this is just a really good time to just review yourself, check yourself. Let's take a look at our organization and let's make sure we're doing the right things for the right reasons, because we can get very complacent. Okay, like when we were looking at the demographics of who took our surveys, and we took a look around the room, and it really fit who, the people that are coming to these meetings and our coworkers, but not necessarily the clients that we serve. So it's super important that we just take this time, we look at it, we make sure that, again, we're doing the right things for the right reasons. I slide that up. Maybe.
Where are you going?
Required training.
Right here?
Yes. The sign-in sheet should be going around. Has anyone not signed the sign-in sheet?
Yeah, there's like 5 or 6.
Okay, let's go through it. Let's go around one more time. I need that because again, this is Title VI training. I am required to have everyone who's part of the coalition have this training, and this is my proof that it happened today, so.
I'm sorry, I'm trying to share it with him too, and
Yes,
it's
I
not
need to
working.
see.
There we go.
All right.
I think, yeah.
You have to scroll down to one and just keep, yeah. All right, so our objectives today is to understand the meaning of the word prejudice and the legal definition of discrimination and the covered groups. We are to know the major non-discrimination laws and covered groups that are protected by these particular laws and the effects on these groups while delivering services. We are to know how to recognize possible violation and to know our obligations and responsibility under state and federal laws, and to understand the basic measures needed in order to achieve non-discrimination compliance. Keep going. This is a quote that we've been quoting for years and years in Title VI. Hating people because of their color is wrong, and it doesn't matter which color does the hating, it's just plain wrong. We do not discriminate against anyone for anything particularly because of their shade of skin. Prejudice. The definition is an opinion or adverse judgment to anything without just grounds or before having significant knowledge. It is also an irrational attitude of hostility directed against an individual, a group, a race, or their supposed characteristics. Prejudice can be for or against an individual, group, or object. Any individual or group can hold prejudice towards another group, individual, or object. So examples, a person could be prejudiced in favor for anyone with a Southern accent, could be prejudiced against anyone with another accent. So from where they're from. And it's just a thought process that you have, like, oh, those people are not because they talk this way, these people are made because they don't. He was prejudiced to give her services solely on her looks. I'm not gonna hire this person because they wear glasses, so they may not be able to see the lines clearly. I mean, like, that's not okay. Discrimination is differential treatment that favors one individual, group, or objective over another. It is illegal treatment of a person or group based on race, color, national origin, religion, age, sex, pregnancy, disability, citizenship, familial status, veteran status, or genetic information. Discrimination is often the result of actions based on prejudicial attitudes. In most cases, an institution or entity may treat individuals differently unless the individual is in a protected group or class as defined under law. It is discriminatory and illegal to deny provided services to an individual based on race, color, national origin, or having limited English proficiency. It is discriminatory to provide a service differently, like unfavorably, than what is provided to others, at least in part because of race, color, or national origin. It is discriminatory and illegal to deny employment to someone based solely on the fact that that person uses a wheelchair. It is discriminatory if an agency offers services to recipients ages 1 to 21 and deny persons services because your belief is that age 21 recipients do not need the services. So Title VI comes from the Civil Rights Act of 1964 for program services. Title VII is Civil Rights Act of 64 for employment. Title IX of the Education Amendments of 1972. And Section 504 of the Rehabilitation Act of 1973. Age Discrimination Act of 1975 and American Disabilities Act of 1990. Okay, I'm just gonna let you read that for a second. Go ahead. Go ahead. So what is Title VI? For programs and services, no person in the United States shall, on the basis of race, color, or national origin, be excluded from participation in, be denied benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. If we receive money from the government, we are obligated by law to treat people the same way. We cannot discriminate against them because of who they are, who their parents are, what age they are, what their disability is. We cannot do that legally. It's also not the right thing to do, and we are in the profession of serving others. Prohibited practices: denial of any service recipient, any services, opportunities, or other benefits for which an individual is otherwise qualified. Provide any service recipient with any service or other benefit which is different or is provided in a different manner from which is provided to others in the program. Subject any service recipient to segregated or separate treatment in any manner related to his receipt of service. Restrict the service recipient in any way in the employment of services, facilities, or any other advantage, privilege, or other benefit provided to others under the program. Prohibited to adopt methods of administration which would limit participation by any groups of recipients or subject them to discrimination, and address the service recipient in a manner that denotes inferiority because of race, color, or national origin. All right, so let's talk about limited English proficiency. So that is defined as the inability to speak, read, write, or understand the English language at a level that permits the service recipient to interact effectively with the staff in accessing public services and benefits. So when we talk about limited English proficiency, we are talking about people who did not grow up speaking English. It's not their first language. We are talking about people who may not be able to read well. So it might be someone who grew up speaking English, but they aren't able to read and write. That is a limited English proficiency. And so we have to offer services, and that's something that people tend to forget about, is it's not just translation services. You have to meet people where they are. This executive order since August 11, 2000, requires all agencies that receive federal funding to provide services that are accessible to persons with limited English proficiency. Not providing services that are accessible constitutes discrimination based on national origin. So one of the things that the coalition did is we do our TIPS training for convenience stores. And I had a gentleman come through my class and he could speak English very well. And he could take the class, but the test is written. And the test is written with not everyday language. Okay, the verbiage is a little difficult. And so we were having a hard time with him understanding the test in order to take it. So in order to be Title VI compliant, we had to go and get the test translated. into the language that he speaks. So, you know, do we have to do that for like every brochure or every poster that we do? We don't. But if we have a direct client that needs that something specific, then we need to. We do have a growing Spanish-speaking population, so we do have to offer our brochures and some of our forms in that language, or be ready to get that translated, because we have a large population here. But if, say, you know, there's a language that only a few speak, say Hindi was what we had to get the test translated into. We don't have such a large population that I have to have everything translated. Does that make sense when it comes to what you legally have to do when it comes to English proficiency? To be in compliance, you have to develop and implement written policies and procedures for language access, to access language needs of your consumers and community, train your staff, and monitor. So the types of language services is oral interpreter services, bilingual staff, telephone interpreter lines, written language services, and community volunteers. What you don't want to do is say, well, you have to provide your own training, your own translator. You don't want to talk to a minor child and have them translate for their adult parent. Right? As organizations, it's our responsibility to provide that for them. Title VII for employment prohibits discrimination by covered employers on the basis of race, color, religion, sex, or national origin. Also prohibits discrimination against an individual because of his or her association with another individual of a particular race, color, religion, sex, or national origin, such as an interracial marriage. In the late 1970s, Title VII began to prohibit sexual harassment and sex discrimination. And in 2012, employment discrimination on the basis of gender identity or transgender status is prohibited. This is where the Equal Opportunity Employment Commission, as well as a certain state fair employment practices agencies, enforce the Title VII. 504 is the Retaliation Act. So Section 504 prohibits organizations and employers who receive federal financial assistance from excluding or denying qualified individuals with disabilities an opportunity to receive program benefits and services. Rehabilitation, not retaliation. Sorry, there's a retaliation clause in here somewhere too. Qualified individuals with disabilities are persons who have a physical or mental impairment which substantially limits major life activities. And one or both of the following. With reasonable accommodations, they can perform the essential job functions, or in terms of accessing and receiving public services and benefits of persons who meet the normal essential eligibility requirements. So if it's someone who just needs a reasonable accommodation, I can't stand for more than 30 minutes at a time before taking, 2 minutes off my feet. That's reasonable. Someone who says I can't stand at all and I have to have a stool and sitting on a stool enables them to do their job is a reasonable accommodation. So that's what you have to look at. Can you reasonably allow them to work without undue hardship on the business? So physical and mental disabilities include but are not limited to visual, speech, and hearing impairments, intellectual disability, mental or emotional illness, cerebral palsy, epilepsy, muscular deficiency. Thank you. I get it wrong every time. Multiple sclerosis, orthopedic conditions, cancer, heart disease, diabetes, contagious and non-contagious diseases such as tuberculosis and HIV. So we just covered the reasonable accommodations. So the Act of 1990, we talked about that. Go ahead. Did we just go through that? Okay. So Major life activities means functions like caring for themselves, performing manual tasks, walking or seeing, eating or sleeping, interacting with others, learning, concentrating, thinking, or working. This act prohibits discrimination against qualified individuals with disabilities based on their disability in all programs, activities, or public entities. Public entities include state and local governments and their departments. Go ahead. All right, so preferred and offensive terminology. We know it's all in the framework, right? And it's how you say things. So words hurt. It is really important that we have the right mindset and that we are using the right terminology. Like we say person with disability and people with disabilities. We don't say that they're crippled or they are disabled. It's a difference between who they are and what they have. Okay, a disability doesn't create their identity, and when we address that, it's really important to use that right terminology. Person first, yes. Age discrimination. This protects persons who are 40 years of age or older from employment discrimination based on age. The first time I took this training, I was like, I never have to worry about that. All right. This protection applies to both employees and job applicants. It is unlawful to discriminate against a person because of his or her age with respect to any term, condition, or privilege of employment, including hiring, firing, promotion, laying off, compensation, benefits, job assignments, and training. Go ahead. All right, keys to effective civil rights compliance. Want to make sure that recipients receive equal treatment, equal access, equal rights, and equal opportunities without regards to their race, color, national origin, age, gender, or disability. It's enforced through complaints. We get a complaint, there's a complaint process and has to be reported to the state. Compliance reviews, we get reviewed when we get monitored, and then agency activities such as our education, training, and technical assistance. If someone feels that they have been discriminated against, then they come for the coalition, they would come to me, or they can call the hotline itself. Complaints of fraud, waste, or abuse. Citizens and agencies are encouraged to report fraud, waste, and abuse in state and local governments. To report illegal, improper, or wasteful activities, you want to call the state comptroller. That is not part of Title VI. It's not covered underneath that, but the state does say that, hey, if they are using our money, let's make sure they're doing it wisely. And so if there is waste, then call the comptroller. Retaliation. It is illegal to fire, demote, harass, prevent services, or otherwise retaliate against people because they filed a charge of discrimination, because they complained about discrimination, or because they participated in a discrimination proceeding. So someone should, if they feel discriminated against, they have the right to say something. We don't have the right to hold that against them. It's the way they feel, and we need to address it. Go ahead. Go ahead. All right, this is the Title VI coordinator's duties. Basically, I need to make sure that every volunteer employee is trained upon hire or when they start volunteering, and then annually thereafter, and then to do these reports and send them in. We don't need a break. Keep going. Whew. Those are all of the acts and things to know. We'll send out this link. You guys can read that in detail. Go ahead. Go ahead. Just review what we've already talked about. Am I going too fast? Y'all want me to slow down, read all that? All right, just checking. Keep going. All right, we have our Title VI poster posted up there. In conclusion, in both the United States and Tennessee, everyone has the right to fair and equal delivery services, regardless of the long list, race, ethnicity, national origin, religion, political affiliation, level of education, place of residence or business, age, gender, marital status, physical appearance, mental or physical disability, sexual orientation, genetic information, source of payment.
She done had it with you.
All right, we have to take a test, Mel. Right, hold on. She left me.
Is there another clipboard going around
Tell me I
somewhere?
graduated college. Come to work and take more tests.
'Cause I was gonna say,
This
there's
feels
a
like a
lot
scam.
more people in here.
Everybody, he has this for
Miss
her.
Jessie, you told me I graduated college just to come to work and take more tests.
Yes.
Feels like a
Okay,
scam.
I don't know how to get this. I need you to go back to the test. There's, you have to take the test. That's the other link. What do you do? No. There you go. Yeah. Oh, good to hear. Yeah.
Hold on, I haven't, let me share it.
All right, so here's our test. And you guys gotta tell me what the right answer is. Title 6 of the Civil Rights Act of 1964 states that no person in the United States shall be excluded from participation in any program, denied benefits of, or subject to discrimination based on what?
Race, color.
All the above isn't listed.
Oh,
Race, color, national origin. That is correct. Go ahead and click it. Okay. Who is a limited English proficient person? A person who does not speak English as a primary language and has the limited ability to speak, write, or understand English. A person from the United States that cannot read. A person who does not speak English at all. Or A and C. A and C is correct. What is non-compliance? Assuring Title VI compliance is met as quality assurance function. Failure or refusal to comply with Title VI of the Civil Rights Act of 1964. Putting Title VI non-discrimination language in any contract, agency, website, brochures, and training materials, or none of those. What is non-compliance? Failure to refuse to comply with the Civil Rights Act. When utilizing the four-factor analysis for limited English proficiency, which items should be used to assess the population being served? Number of proportion of people, races in the service region, frequency or potential of LEP contact with the program or activity, nature and importance of the program or activity to the people, all of the above.
All of the above.
All I'm hearing is all of the above. Correct. Where am I?
Right here.
How does an agency evaluate its current limited English proficiency practices? Identifies actions already being taken and existing tools that can be used to provide meaningful access. Inventory existing materials that have been translated into other languages. Staff awareness and responsibility plan. All of the above. All of the above. Agencies, subrecipients are not required to have a Title VI coordinator. True or false? False. Correct. Agencies, subrecipients are required to have an LEP plan. True. New employees or volunteers do not have to be trained or informed. False. All employees must be trained or informed of Title VI annually. True. Title VI complaint procedures and logs are not required for agencies and subrecipients. Title VI posters should be posted in the agency in conspicuous places that are available to employees and service recipients to view. Title VI brochures should be placed in the agency in its conspicuous areas that are available to employees and service recipients. It is not necessary for the agency subrecipient to provide and document Title VI training to staff on non-discriminatory issues and policies. Failure to comply with Title VI can result in cancellation, termination, and suspension of the contract in whole or in part. Fraud, waste, or abuse is a Title VI issue. False, that's comptroller. We pass? Whoop, whoop. Good job, good job.
Oh, just so smart. Okay, we now have on the agenda rural reentry.
So my name's Lynn Ventola and this is Scott Holloway. We are really new employees at the reentry program. I've been there for like 2.5 months and he's been here for 2 weeks. So,
What is your position there? What do you guys do?
we're both case managers and we're doing assessments and things like that with our clients and providing services for them, mostly pre-release, and then there's 2 other case managers that do post-release services. But our goal is to reduce recidivism in the jail, so
I'm trying, and I didn't take notes when I was talking to Christine, but she was talking about partnering with people when they come out.
yes, so we're both trained to teach MRT, and a lot of my clients have been asking how they can continue because we only have a pretty small amount of time with our clients and we can only get through about half of the steps. So we're wanting to partner with somebody in the community that can kind of pick up where we leave off and continue that for these folks. Hopefully, and we want to start some sort of aftercare program anyway, but I think if we can continue these services for these people, it may help. So.
Do y'all still do the parenting classes and anger management, all that with Eric?
Parenting classes, I think Eric's been off for the summer, I don't know, but, so Life Choices came in and did parenting classes, the first 2 classes that I was a part of. Hopefully Eric will be coming back. But we are always looking for people that can come in and speak and provide some motivation or services or resources for these folks.
I was going to say, having been an employee of Christine, you might explain to people what MRT is. If she's asking for help from the community, because a lot of people don't know what MRT is.
It's moral reconnection therapy, and it's a 12-step process. We can get to about step 7 with the time we have with our clients. And it's just designed to kind of change their thinking and their mindset and hopefully reduce some of their criminal thinking.
MRT is a program we have done with youth for, 10-some years. And so we do the watered down juvenile version and they're doing the adult version. It was created for repeat offenders and the Memphis prison system. And it was very effective with that clientele, which is a very tough clientele to get positive results from. So it is a very, very good program. But in order to meet fidelity, you really have to get through all of it. You get it, and it's a 12-step process, but it's not like the 12 steps of recovery.
No.
Okay, but there are 12 steps to this program as they're learning to do things like learning how to trust. You think that's basic, but it's really not. There's a thought process that has been broken. And so we're trying to teach them to make decisions based on a higher moral value. So we have to teach them to trust and to be honest and to think about other people and, you know, realize that you have interactions within the world. And so by the time they get to step 7, they're starting to make their long-term plans, but then it's about the steps they're not getting, or, you know, how to maintain that and how not to slide backwards, and, you know, realizing that now you're in a different place than where you were. It's a super amazing program. It is, I see so much success with it, with youth, that we're really, Alan's been talking with them about, you know, continuing that on for adults. So if we can get them to come after they come out, that would be the key. But also that will keep them from making those same thought cycles that get them in prison to begin with.
How are the classes? Is it 12 1-hour sessions, or what are they?
So we have, each class session that we do is about 4 weeks long, and we have 3 1-hour sessions each week. So our class is kind of large, and the first couple of steps are pretty lengthy and take a little bit of time to get through. So that takes up quite a bit of the time that we spend with them. So we can get to about step 6 or 7 within the 4-week period that we're with.
It's not just you do the work and you pass the step. With MRT, you got to be living it. So, you know, the first 3 steps is honesty, trust, and acceptance. Well, those are the 3 hardest things for people to process and get through. And the thing with MRT is that it's a sliding scale. So you can't say it takes 12 sessions, because for the youth end, our average is probably 20 to 24 sessions. And that's just because they don't pass it the first time because they don't get it. But, you know, you can read it and you understand what it says, but you're not doing that. And so until your behavior starts to model that, then you don't progress onward. And then if you get up, or, you know, you're getting up here and you're working on your goal, step 7, but you get caught doing something extremely dishonest, well, guess what? You're back down to that step, you know, and then you have to work your way back up. So, I mean, that's just kind of how MRT is set. So it would be difficult to try to get them through in 4 to 5 weeks.
And I think when it was designed in a prison system where people are in, they have like a pretty long sentence, and most of the people in jail are just, they're not there for that long. Some of them are, but so like we might have somebody get out in the middle of a class that we're doing, and they're asking for, how can I keep doing this? So now we've got some resources for them.
What's great is by the time they get past 5 and 6, they get it, and they understand how important it is, and they like the changes that they see because they start to recognize it, so they would seek it out.
Yes. And my concern is that we're going to send these people who've been in jail out into the real world with no, I mean, we follow up with them and make sure that they're like working or in treatment or whatever their plan is, but there's no real like therapeutic aspect once they were released from jail. So we have somebody that can continue that would be also be good.
All right, there's lots of announcements. One of the things is in your packet, you saw the Townsend Day Festival, and that is going to be August the 5th and 6th. That will be at the Townsend Cultural Center, which is right on the other side of us over here. So that's in here. Thrive Conference, Jesse mentioned earlier, is July the 6th to the 29th. That will be at Camp Rain, and that is for youth. Zumba classes are also on Tuesdays, Thursdays at the Rain Teen Center. Rain Teen Center for youth is Wednesdays and Fridays for middle and high school.
No, Fridays is new. That's something you were able to start in June, and it was so well received that we're gonna continue it as long as we have participants coming. So that's just one more thing for youth to be able to do in a, safe, structured environment. So that's pretty exciting. So that we've talked about for years and just couldn't make happen, so.
What's about the average attendance for that?
We've been getting like 15 to 20, where on Wednesday nights we're saying, 40, 45. So, but it takes time to grow that. So the ones that are coming are really consistent.
Also, don't forget to give a kid a chance, July the 20th. And there's a link on here for the Franklin County Library event that's going to be happening as well. Laurel, you want to talk a minute about the Isaiah 117 House of Lemonade stands that were everywhere?
Yeah, we had lemonade stand day this whole weekend, and there was a lot here in Franklin County. And we appreciate that support. And then there was some things going on in Grundy and in Helen Park and a couple in Coffee County, and so we had a good weekend raising money. But the big announcement is that we will finally have the ribbon cutting for the Isaiah 117 house, August 10th at 2 o'clock. That's a Wednesday afternoon, and we want to have everybody here, representatives of everybody in Franklin County, because that house will be serving all the foster children of Franklin County as well as Coffee and Grundy, and we're up in Mont Eagle, right behind Christ Church. And I will send I just made a note to send the announcements and the invitation for the ribbon cutting out to y'all. I would send that to Jesse, right? Okay. So that is an exciting day for us. The house is beautiful. If anybody's driven by and seen it yet, and go to our Facebook page, Isaiah 117 House, Coffee, Franklin, Grundy. It is a transitional home for foster children. I know that Susan has spoken about it here with this group, but it's been 3 years in the making, and it's finally coming to fruition. So, and then we have our golf tournament September 24th at Willowbrook Country Club in Manchester. And so let me know if you want information on that. I've printed up some sponsor sheets and some player sheets, and I left them in the car, but we're looking for sponsors for that. And got a few other things going on, but please look at your Facebook. Isaiah 117 House, Coffee, Franklin, Grundy County is our Facebook page. But we love to have a huge Franklin County turnout at our ribbon cutting. So please let everybody know.
Isn't there a lemonade stand this afternoon at the Red Roof Pavilion and for the Isaiah House?
There might be, I don't know.
Yes, there is.
Okay, I knew we had them Friday and Saturday and Sunday, and if somebody's doing one Monday, okay.
I think it's from 4 to 8. I'm thinking.
It's 4 to 8.
4 to 8.
Okay.
Yeah, the Red Roof Pavilion.
I did not know we had one for Monday, so, but I'm sure Susan knew. So, okay. Red Roof Pavilion, that's at the Winchester City Park?
Yes.
At 4 to 8 tonight.
From 4 to 8, yes.
I can go.
All right. As we're finishing up the meeting today, your certificates will be coming around.
Take yours.
Take yours and pass it down. Melanie.
If
has
I
it in
missed
order.
you, it's up here. I didn't recognize your name and face. So if I missed you, it's over here.
All right. Anything else that needs to be added to the agenda or announcements or upcoming events?
I just wanted to say that I have Timby Kids. If anybody doesn't know who Timby Kids is, the mayor that has a book that comes with him that explains how his parents' addiction is not his fault. I want to get that in the hands of anybody that casework or that works with young children whose parents are struggling with addiction. And I have kids across the way, but if you'll see me before you leave, I'll make sure they get to you. So Isaiah House.
Yours will be up here.
Anything else?
I'm gonna throw in the library and the summer reading bash. I know Kathy and Tina are on Zoom. It's July 29th, 2 o'clock, City Park. There'll be a ribbon cutting for the story trail. And there'll be bounce houses and water slide and bunch of fun stuff. So I believe 6 o'clock that evening. Everybody come out and join. If you want to set up a booth, get a hold of Miss Tina at the library and she'll get you connected on all that. And if you need any more information, you just go to contact.
Thank you. Anybody on Zoom that has anything you need to announce?
Yes, I do, if that's okay. Just wanted to share first of all that SOCAT's always taking referrals for any child, youth, or young adult that may be experiencing any mental health or behavioral needs. Our services are free and in home and doesn't require a diagnosis. So I put the information to make a referral in the chat, as well as my information if anybody has any questions. And also, we are in the final couple weeks of our community needs assessment survey for Jackson, Perry, and Grundy County. And I know this is Franklin County, but if anybody there has any connections to any of those counties, that can help us get a few more surveys. Anybody that lives or works in one of those 3 counties can fill them out. So any help with that would be much appreciated.
All right, thank you. Anyone else? Okay, well, if that is all, our next meeting will be August the 15th at 12 o'clock. That's last day for election, isn't it?
The library has an announcement. Sorry.
Yeah, go ahead.
Hey, sorry, we were trying to hurry up and get it unmuted. Just wanted to say real quickly, the Trail Tale grand opening, you guys had the flyer up there. But tonight we go before county commission for the final hearing, we hope. We're looking at purchasing land for a new facility. This is the second big hurdle. So you guys want to come out? Yes, I see that, Mel. Thank you. So we're hoping this is the beginning of a journey to Franklin County Library, Archives, and Museum.
Wow, wonderful. Yeah, good luck.
Big round of applause, everybody. Come on. Woo!
All right, thank you. Okay, well, that concludes our meeting for July of 2022. Y'all have a good rest of the day.